We're starting in 30 seconds. 30 seconds. I hear a lot of people out in the hallways. Come on, everybody, let's go. We have a big award to give. Come on. Hi, Gavin. How are you? Good. Thanks for coming, man. Glad to see you brought somebody too. Oh. Maybe I should have you guys speaking. All right, here we go. Come on in, everybody. Let's go. Let's go. Okay, we're just about ready. We got a couple of people at the back. Come on in and sit down. Is Kelly Geyser in here? Is Kelly here? Because I'm in trouble. Come on, everybody. Almost in. Let's go and get in our seats, and let's get everybody's cell phones back on silent or on vibrate. Okay. Okay, enough with the hugs now. Let's sit down. Nancy, is everybody up? How are we doing? All right, here we go. By the way, I just want to give you a quick report on the weather conditions in St. Paul, Minnesota. It is snowing there now, my son tells me. The first of about 12 inches between now and when I'm supposed to land tomorrow afternoon at 4 o'clock. I want you to feel sorry for me, even as you feel grateful for the fact that you're not going where I'm going. All right, Mark and Julie, come on back. Here we are. All right. So that worked out, didn't it? A little shorter intermission. We got everybody out there. A couple of people got their smoke break. You guys did your jobs. Good job. Okay. So we're more than halfway through the program. We have 2 awards and 2 speakers left, and then we're going to have a little Q&A. If you have any questions or comments that you want to offer, write them down or think about them, and we're going to have the panelists or the speakers up here in chairs, and we're going to have microphones, and so you can ask your question, and we can continue to have a dialogue for about a half an hour until we wrap it up on time. I think it's at 5:30. Is that right? Yeah. Okay. Remember what I said earlier about the power of we? It's much more than just us. It requires community leaders and advocates and policymakers and concerned citizens. People like our next recipient of an Achievement in Advocacy Award. An award that we give proudly today to Terrell Pyburn, the city attorney for the city of Coconut Creek, who worked for the city of Delray Beach and whose expertise in public policy, expertise in legislation, along with her passion to help people, all of those things she's brought together in an effective, profound way to raise the standards to protect people in early recovery living in sober or recovery residences in this community. And also, and do not underestimate the power of this component of her efforts, she's also led the effort to crack down on people and businesses that took advantage of vulnerable people. In other words, what she has done is to provide those vulnerable people early in recovery struggling with substance use disorders. What Terrell has done is to give dignity and respect to people who deserve it. Help me to recognize Terrell Pyburn.
I just want to say thank you. I do not deserve this recognition. All of you deserve this recognition for all the time that you have put in. I am, however, grateful for the opportunity to serve all of you because it really just, I think substance use disorder has impacted everyone. And I have viewed it as my life's mission to do what I can to try to make sure that those who are trying to get treatment, who are trying to get help, are able to get the help they need without being exploited and without being taken advantage of. So I thank you very much for this award.
Thank you, Phyllis, so much. Thank you. I feel like I'm winning an award by giving out these awards. It's kind of cool. I knew of Scott Strode long before I met him for the first time last night. How could I not know about Scott Strode? My wife, Nell, is the national director of the Phoenix. Scott is the founder and the executive director of this not-for-profit, whose personal vision has now touched the lives of thousands of people who have discovered the power of recovery in sober, active communities across this nation. Help me to welcome Scott Strode.
I couldn't have imagined that the most painful part of my life would lead me to the most meaningful part of my life. I guess it's really not a surprise. Pain is a powerful catalyst for change. Countless nonprofits have been started because of an individual's personal struggle. Then they want to help others heal from that same struggle. Pain is actually so powerful that it started revolutions. But over the years, I've had the blessing to be able to see thousands of people tap into the resiliency of the human spirit. And what I've now come to believe is that pain actually isn't the most powerful catalyst. Hope is. Hope of a better life. Today I want to talk about both those things, both pain and hope. So I grew up in a small town in Pennsylvania with my brother and sister. My mom and dad divorced when I was young, and we spent every other weekend with my father on his farm. That time that my brother and sister and I shared playing in the woods, fields, and streams of Pennsylvania, and playing behind my mom's home in a small neighborhood in Pennsylvania, are some of the most meaningful moments of my childhood. But not all of my childhood was nurturing. I struggle with a learning disability. And in those days, I was made to feel stupid because my mind didn't work the same way as other kids. My mom and dad each remarried and then divorced again. And my father had his own challenges. His father left him when he was young, and he carried that pain with him and passed it to us. He struggled with mental illness. So we never really knew which dad was going to show up that day, so we were always on edge as kids. His anger was scary. He was my size at that time, and when he would get mad, there was always a threat of physical abuse. He was emotionally abusive, and he would belittle us and shame us in public. That was really hard for my siblings and I. When my mom remarried, it introduced alcoholism into the family. A family outing on a Sunday was all piling in the station wagon and driving across the state line to Maryland to buy a handle of vodka because they didn't sell booze in Pennsylvania on Sundays. And a family picnic really wasn't a party until somebody went to the hospital for something alcohol-related. On top of that, and in spite of that, there was an expectation of being perfect. And we were always reminded when we'd fall short of that impossible goal. My mom did her best to insulate us from these things when we were kids, but it still had a profound effect on me. See, I believe that those childhood experiences, both positive and negative, start to forge the lens that we see the world through. And those early childhood traumas tint that lens ever so slightly that we don't even notice we're seeing through that. We make our decisions based on those experiences. And for those of us who have a lot of those traumas, what ends up happening often is we have trouble finding our emotional well-being internally. We're left looking for it outside of ourselves. Sometimes it's how much money do you make, or what do you look like, or did you achieve those goals you put out there in life? Sometimes we just numb it out with drinking or drugging and try to make that go away. Those things, those adverse childhood experiences, or ACEs, are something I encourage all of you to learn more about. I would look that up. The ACE study was amazing. I think it was like 70,000 people or something they studied, in kind of middle income bracket. So it wasn't even folks that had other struggles that they were trying to overcome. But on the ACE score, I did my own ACE score, I'm about a 6. And according to that, the likelihood that I will die almost 20 years earlier than somebody who hasn't experienced ACEs goes way up. I'm more susceptible to depression, suicidality, substance use disorder, and chronic disease in general. I don't believe that my fate is sealed. I think I can change that life path. The challenge with ACEs, though, is they're often passed from generation to generation. There's a quote out there that says, pain is handed down from generation to generation until somebody decides they're willing to feel it. I wasn't ready to feel it yet. I was just 11 years old. So I picked up a drink for the first time at 11. By 15 years old, I was using cocaine, I was depressed, and I was suicidal. I drank and I drugged my way through life until I was 24, living in Boston. And then, coming up on 22 years ago, I got sober there in Boston. I got into a boxing gym, and there was something special about getting in the ring for the first time. It gave me a different confidence that I didn't have before. Somebody introduced me to climbing and triathlon and running 5Ks, and I eventually ran the Boston Marathon. And every time I crossed the finish line, I stood a little taller, and I started to think that maybe the lessons I was taught as a kid weren't true. The really special thing about that time in my life was the group of people that I had surrounded myself with. I had built a new tribe, a new group of friends that would rather get up at 5 in the morning to go ice climbing than stay up till 5 in the morning drinking and drugging and doing what I used to do. So we had all sorts of adventures, and one day I said to him, I was like, hey, what do you think about the idea of us starting a nonprofit that does this for other people? They said, that's great, you should go ahead and do it, and good luck. But they started to realize that I was serious, and many of them got engaged in helping. I had friends that were climbing partners and friends that had been clinical social workers. We came together, we started a nonprofit, and we decided to call it the Phoenix, because I believe we're all rising from the ashes of something. Phoenix is a really simple model. You only have to be 48 hours clean and sober to come to one of our programs. You have to adhere to a code of conduct that is designed to create a trauma healing environment. So essentially, anything that isn't nurturing isn't welcome at a Phoenix event. People show up at this event, and the first thing they say is it really free? And I say, yeah, it is. And then the second thing they said, totally free. And I say, yeah. But we have peer instructors, and many of our folks have walked the same path as the person walking through the door. So we go with them into the gym or into the climbing gym or into the yoga class, and we turn them onto a sport that meant a lot to us in our own recovery journey. And it's amazing to see what happens. At those workouts, When everybody's done and everybody's laying in a puddle of sweat on the floor afterward, and they reach out and they just do that little fist bump, Phoenix just happened in that moment. That person started to think of themselves as more than just their ACEs, more than just their addiction story, and maybe for the first time in their life, they start to develop this positive identity. The thing about the Phoenix, though, is we don't really want to think of it as an organization. We're trying to think of it as a movement. This idea that if you need it, and you need your new tribe, and you need that support, that you could start something like Phoenix. We're doing our best to scale the program all over the country. In the last 12 years, we've gone from 3 states to over 22 states. And we're now in over 40 communities nationally. But more than that, we're taking the opportunity to mentor any other program that comes up that's like the Phoenix. Because we can't be everywhere, and we need folks in communities around the country to start their own programs. That kind of brings me to my next part of the talk, which is about this business term that you may have heard called creative destruction. This idea that what we create today will be so much better than what we had yesterday that we will transform the landscape. A good example of creative destruction is cell phones to payphones, right? Laptops to typewriters. We haven't had that kind of evolution in the recovery support space for a long time. It's time for it now. But it's going to take all of us. It's going to take innovative ideas, us thinking about things differently. So that brings me to a call to action, something that all of you can help with. The first thing is, if we know ACEs exist, we have to also believe that there's the opposite. There's nurturing, there's loving, there's support, there's healthy attachment. Some of us got some of that in childhood, some of us got none of it in childhood. But we can build it now. In all of your relationships, I ask you guys to aspire to bring that loving, nurturing, supportive. Not just your close relationships, but people you interact with on a daily basis, people that you may not even know well. See if you can find a way to be there for them, to support them. Because I guarantee if you do that, you're going to get that same energy back. More importantly than that is to be able to find love and compassion, not for others, but for ourselves. Right? We're all perfectly imperfect, just as we are. Pia Melody says that, and I love that. We're all perfectly imperfect, and we can find that love and compassion for ourselves. One of the Phoenix team members said to me, and it sticks with me, Phoenix didn't make me strong. They just reminded me that I am. So let's do that for others in our life, including our own children. The other thing I want to ask, because I know there's people that work in the treatment space out here, is those of you that are doing really good trauma work, I challenge you to think about how to get it outside of your office, how to get it outside the walls of your treatment center. How do we bring trauma healing into the world? Imagine if we could do trauma healing in prisons or in programs for people experiencing homelessness. Imagine if we could reach the 90% of people that never get to access formal treatment, or if we could even do it in high schools. And lastly, I ask you guys to join me in creating this revolution, right? This idea that we're going to do things so differently today that it's going to change the outcome tomorrow for people struggling with substance use disorder. And that's so important because if ACEs pass by generation, imagine the kids growing up under this addiction crisis. Imagine the next wave that's coming. The only way we can brace for that is for all of us to step into that work and form a revolution not born from pain, but born from hope. So we can hold up that light of hope for people that are still in the dark and tell them that recovery is possible and we're here for them. So thank you. Yeah.
Thank you, Scott. I got a quick question for you. My colleague Brenda Eiliff is always reminding me about the role that addiction and recovery play in older adult populations. Sober, active community. How does that apply in an older adult population, knowing that we're in a state that has a lot of older adults who either are in recovery or need to be in recovery?
Yeah, I mean, I think one thing I've learned as I've gotten older as an athlete is just being consistent. You got to move your body consistently. It doesn't have to be a lot, but you just got to move it consistently. So if you're in recovery and you want to organize something like this, get some friends together and do a walk. And maybe you conclude the walk at one of these beautiful vistas overlooking the ocean, and you just have a social event. The folks that can come on the walk, great. If people can go faster, they can jog a little bit. And other folks can just hang out and keep the coffee warm and kind of lead the social part. It's really about coming together. It's not always about the activity. It's about the tribe.
Scott Strode. Thank you, Scott. Woo! Just very quickly, I was remiss earlier. I saw a good friend and fellow traveler who, can somebody take this? Who's been a supporter of us at Hazel and Betty Ford, Steve Waymeyer. I don't know where Stephen is. Oh, there you are, Stephen. Thanks for everything that you've done and are doing for the recovery community at large, and specifically for Hazel and Betty Ford and your role on the council and all the other good things that you've done for us in Naples and beyond. Thank you, Stephen. We're almost there. We have one more honor award that we'd like to give at this time, and it's really done in the spirit of the other two Achievement and Advocacy Awards that we have bestowed today. This one is to Palm Beach County Commissioner Melissa Mckinley. You've seen what she's done. You can see it in your program, and I can't do it justice because it's all in there, but I want to tell you, in knowing about her work and reading about her work and talking to people who have seen the results of her work, the real reason why she's getting this award is because of the thousands of lives in Florida, thousands of lives in Florida that she has helped to save. She was the very first, I think, very first public official who recognized the ravages of opioids here in Florida and was really the one that helped to get the powers that be in the state of Florida to declare the opioid epidemic precisely what it is. And what is it? It is a public health emergency. A lot of people had seen this as something that was to do with criminal justice or ignorant doctors or junkies or pharmacists who didn't care. And it was all of those things, right? But what it really was a public health emergency. And it was through her work that this state became not just ground zero for the problem, but that this state has now become ground zero for the solution. So please help me to welcome Melissa Mckinley.
You know, I'm a politician, so we have to take the microphone when we get a chance. I have to tell you, it must just be a coincidence, but yesterday was International Women's Day, and so to be honored with Terrell and Ariana. You know, our previous speaker spoke of his childhood ACE score of being a 6. Well, mine is an 8. But for the grace of God, I stand here before you today. My mother was an alcoholic and a prescription drug abuser who went cold turkey and then decided to go back to school and become an RN, and she was the charge nurse at the local crisis stabilization unit, dealing with mostly adolescents who were homicidal and suicidal and many who were drug addicted. Unfortunately, because of all the physical work that her job entailed, she suffered degenerative spinal disorder and became addicted to prescription pain medication. I never really thought anything of it until I had my wisdom teeth pulled when I was about 25 years old, which, was just a few weeks ago. And she called and asked if I had any left over. And I didn't think anything of it. Back then, those medications were nothing more than Tylenol or Advil. And the last 7 years of her life, I was not able to say goodbye to her before she died a year and a half ago because oftentimes she wasn't sober enough to hold a conversation. She succumbed to stage 4 lung cancer, but when they found her on the couch with 4 bottles next to her. I'm a former wife to an alcoholic. I spent 15 years in a marriage that was not healthy. Thank God, a few years after we got divorced, for the sake of our 3 children, he has now been sober and should collect his 6 or 7 year coin this year. So I am the sister to a sibling who survived an overdose. One of my siblings is a cancer survivor, and through all of that, they thought it would be a really good idea to prescribe a benzodiazepine for 10 years, and she had an overdose, and when she actually left the hospital, they re-prescribed a benzodiazepine. She's happy, healthy, not taking any medication. She's gone from homelessness to starting a small business. Doing very, very well over in the Tampa Bay area, and getting ready to close on her first home post-divorce, post-being a single mom, and I'm really proud of her. I am also the friend to a mother and my former chief of staff who lost her daughter after 12 years with addiction to a heroin overdose. I'm the friend to a young girl that I knew who lost her husband 2 years ago to a heroin overdose and left her with 2 little babies that we just fought for 2 years to get those children into child care programs so she could go back to work. I've watched friends lose their wives, lose their daughters, lose their sons, and it was really my AIDS daughter's passing that I said, okay, enough is enough. Somebody has to have the political will to stand up to the governor and say, this is nonsense. You need to do something about it. So I think my rather turbulent upbringing gave me one really good thing, a high resiliency score, which is important. But I'm not afraid to, pardon my French, to piss off the right people. And so that's what I have done, and it's through the advocates in this room that you all have stood behind me for the past couple of years to make that happen. And this year, under our new governor, he has recommended the highest dollar amount to combat this epidemic that we have seen probably in more than a decade. So I'm so honored. My birthday was this past week, but I had to be in Tallahassee and in Washington advocating on the sober home bill and other things. But this is a wonderful birthday present. We're trying to change the conversation from people across the nation to stop calling this an opioid epidemic and start calling it what it is. It's a substance use disorder epidemic. So thank you all for letting me spend a few minutes with you today. And thank you so much for this honor, and I can't wait to tell Dave Ehrenberg I got one too. So thank you so much.
Thank you so much. Thank you, Melissa, for your courage and for being a beacon of hope to people who need and deserve help. Now to our keynote. Her bio is like all the others in your program, but I will tell you just a very quick story at the risk of maybe running over an extra minute or two. I've worked, as I mentioned earlier, for Hazel and Betty Ford, or Hazel and we merged with the Betty Ford Center 4 or 5 years ago, became Hazel and Betty Ford, but I've worked there for 23, 24 years. I've been the public advocate, which means I'm on the outside. I do a lot of work with Kelly and Kim and Brenda and lots of others in Florida and lots of places. I carry the message. I use my own story. I use the experience of my own journey and all the people I meet along the way. I give a lot of speeches. And I was giving a speech about 4 years ago in a the only place that I know of that's colder than Minnesota in the winter, and that's Fargo, North Dakota. And like I was doing it as a fundraiser for another treatment center that was doing really good work down in the trenches in Fargo. I got there, like I do, and did a little private reception ahead of time. And I met a couple, stood out right away. I was told that this couple, that the man in the relationship was running for governor of North Dakota. He was the unendorsed candidate, Republican. But he was running, and he was there with his wife, and it was nice to meet them. I run into a lot of people who are running for office who are elected officials, and generally they come and they get their award, or they wave their hands and make sure they get seen, and they say something, and then they disappear. But this couple came, and they stayed for the private reception. They sat down near the front row where Mark and Julie are now roughly, and listened to my talk, and they stayed not just for part of my talk, where they could be seen, they stayed for the entire talk. Not only did they stay for the entire 90-minute talk, but they stayed afterwards. Not only did they stay afterwards, but they were literally the last people to leave the Civic Center that night, hours later. And I thought that was very odd, until when we were in the parking lot, your speaker revealed to me where her passion and where their interest came for the subject that brought them to that auditorium that night and brings her here today. Since our first meeting, her husband has been elected governor of North Dakota. I dare say that perhaps there are other opportunities beyond the state of North Dakota for him someday. But in the meantime, his wife has become the First Lady of North Dakota, who is not only using her bully pulpit in North Dakota, but is using her own experiences, as you will shortly hear, to carry the message, to become a beacon of hope, to become an advocate for those who still suffer, and to become part of the we that brings us here today, not just in North Dakota, not just in Florida, but across this nation, to wherever people are suffering in silence, secrecy, and shame. Please help me to welcome your keynote speaker, Catherine Burgum.
Good afternoon. I'm Catherine Burgum. There are two things I never thought I would ever do. One, be First Lady of anything. And two, have the opportunity to share my story with so many people to help break the shame and stigma of addiction. But by some crazy set of circumstances, or maybe by divine intervention, I am both First Lady of North Dakota and am standing in front of you today full of gratitude for the opportunity to be here. The chronic disease of addiction, including the opioid crisis, are some of the biggest challenges facing our nation. While I am not an expert on the disease of addiction, I do have lived experience. I'm in long-term recovery from alcohol addiction with over 17 years of sobriety. Thank you. I spent 15 of those years in silence, keeping my recovery in the closet like a shameful secret. Sadly, only 1 in 10 people who need treatment for addiction actually seek treatment. I know because I was one of those statistics. I knew for years that I needed help, but I didn't seek it because I was ashamed. For people with the disease of addiction, 3 words have deprived them of medical treatment, empathy, and compassion for centuries, or more like decades. And those 3 words are shame, stigma, and discrimination. My journey with addiction started when I was in high school in North Dakota. When I first started drinking, I knew that I didn't drink like others. I experienced my first blackout when I was in high school. I struggled with alcohol-related issues and episodes over the next 20 years of my life. I chose to live and work in cultures with excessive drinking. I had no desire to attend any events that didn't include alcohol, and I couldn't imagine my life without alcohol. While constantly struggling with my addiction, my career progressed, and I had forward movement in my life, but I could never reach my full potential with my addiction holding me back. And there came a time when I knew I needed to stop drinking, but addiction is a powerful disease, and it kept me drinking for many years. I could achieve any goal I set for myself, but I could not stop drinking, even though I experienced many baffling, demoralizing, and defeating drunk episodes. I'd stop drinking for 3 months, and then I would start again. I'd stop for a year, and then I would start drinking again. And this cycle continued over a period of 8 years. I'm so grateful that my higher power kept asking me to pull on my boots and try again. I finally became willing to do whatever it would take to get sober. And that's when the miracle happened for me, and I started staying sober. I found a program that's built on a foundation of gratitude, helping others, and a higher power, and it saved my life. And I'll forever be grateful to this program and its people for embracing me and helping me find recovery. My openness about my recovery has started what I hope will be a lifetime of advocacy, speaking out for those who have been misrepresented and misunderstood. I'm working to create opportunities for the people, families, and communities devastated by this disease. This unexpected journey has opened doors that are helping me to reduce the barriers, shame, and stigma that I faced during my own recovery journey. My platform to eliminate the stigma of addiction is part of a larger movement in our state called Recovery Reinvented. It is a movement that's bigger than me, it's bigger than the governor, and it's bigger than our behavioral health team. Recovery Reinvented is the sum of all the passionate parts working together. We have held 2 major conferences, much like today's event, to bring education, awareness, and energy to this movement in North Dakota. In fact, William Moyers and his wife, Nell, both spoke at our first Recovery Reinvented. As First Lady, it's my mission to end the shame and stigma of the chronic disease of addiction. Stigma, which is defined as the mark of disgrace, is a persistent barrier to effectively confronting addiction and finding recovery. With addiction, stigma puts up walls instead of building bridges. It is socially constructed, based in fear, and usually contains inaccurate information. I met the parents of a teenage boy who died of an opioid overdose in his car in a high school parking lot. They were devastated by their son's needless death. However, there was no community outpouring of support like there would be for a teenager who died of cancer or in a car accident. Shame and stigma keep people away. I believe addiction needs to be addressed and embraced like any other chronic, progressively fatal illness or disease before real changes can be made in our communities and before the shame and stigma can be eliminated. Addiction is not a choice. It is not a character flaw. And it does not discriminate. The stigma of addiction started back in the 1930s when scientists began studying addictive behavior because people addicted to drugs and alcohol were thought to be morally flawed. Those views shaped society's response to addiction, treating it as a moral failing rather than a health problem. which led to an emphasis on punishment rather than prevention and treatment. And alcohol addiction was declared a disease by the American Medical Association way back in 1954. Welcome to 2019, where addiction is still viewed by many as a lack of willpower or as a character flaw, and is amazingly approached with punishment rather than treatment in many communities. The punishment approach brings with it a powerful shame and stigma that influences our laws, services, research, healthcare, and support for people with the disease of addiction. Now more than ever, we must be driven by the data and the facts and recognize the science behind the chronic brain disease of addiction. Scientists, physicians, and even the Surgeon General agree that addiction is a disease. When people with a chronic disease of addiction, their brain gets hijacked in a biological way, manipulating dopamine levels that tell the person that the highest priority in their life is the addiction, and the only choices are drugs and alcohol. It's hard for people to accept the concept that addiction is a disease. I know how hard it is because I didn't believe it myself. I thought I could make the right choices and do the right thing. But after relapsing for 8 years and literally thinking that I was insane, I now understand that no one would choose that life. No one chooses drug overdoses or to lose everything in their life because of meth or to die from years of addiction to alcohol, like so many of my friends have, and my good friend Patrick. With compassion, we need true understanding, and sometimes that understanding comes from having the humility and courage to unlearn things that we have held as truths for our entire lives. A universal acceptance of the disease of addiction across our nation will save lives and provide futures for our next generation of innovators and leaders. It may come as a surprise to you, but there is actually a simple solution to eliminating the stigma of addiction. A solution where everyone across our nation can participate. The simple solution is talk. I learned about this simple solution when I first heard William Moyers speak. I'm here today as an advocate because I was inspired by William to come out of the closet about my own addiction and recovery journey. You see, when I heard William speak, he challenged everyone to talk about addiction and recovery. And I realized at that moment that my desire and ability to help others was stronger than my shame. It was early in my days as a first lady when I decided to reveal my addiction and recovery during an interview with the newspaper. Since then, using my lived experience and my role as first lady, I've connected with awe-inspiring advocates, with parents whose children have overdosed, and officials in the White House, including the Office of National Drug Control Policy, and counselor to the president, Kellyanne Conway, as well as the current inspiring Surgeon General. I always want to say Attorney General, or Surgeon General. The basis of my advocacy is encouraging everyone to talk about addiction and how it has impacted their lives. Those in recovery sharing their stories, caregivers talking about those that they help who are struggling with addiction, people in public service talking about addiction and recovery, and corporations creating safe environments to talk about addiction and recovery at work. Talk will eliminate the elephant in the room and normalize the conversation around addiction. If we do this, the stigma will be eliminated, more people will seek treatment and find recovery, and everyone who is talking about addiction will be saving lives. This is a grassroots movement that costs nothing. It needs no legislation and could easily be the one thing that crosses all political party lines to unify and truly make a difference for our nation. In North Dakota, we are using evidence-based methods to create a system to measure our progress on eliminating stigma. In collaboration with our behavioral health team and the Addiction Policy Forum in Washington, D.C., we launched the first of its kind survey that measured a baseline of the stigma of the disease of addiction in North Dakota. This type of survey, solely focused on stigma, has not occurred in any other state. We are the first. The survey results are informing us of the progress that is being made. It's identifying the gaps and the policies that can reduce the social barriers to care. As a state, we continue to emphasize that addiction does not discriminate and it can happen to anyone. Our stigma survey showed that 60% of the respondents had been impacted by addiction, validating that it touches all families, businesses, and communities regardless of ethnicity, gender, age, or socioeconomic status. The survey also showed that 63% of North Dakotans believe that addiction is a disease, which is a good thing. However, it still means that 1 in 3 people in our state believe that addiction is a choice or a moral failing. Progress will be made when everyone recognizes the science of addiction and moves towards a holistic system that treats it like any other chronic, progressively fatal disease. Data will show if we're moving the needle. Data helps drive funding. Data changes minds and creates systems to ultimately save lives. During the first couple years in my role as First Lady, I spent most of my time connecting with individuals and groups associated with addiction, treatment, and recovery. Every one of these groups and people inspired and motivated me, and they're key figures in helping us reinvent recovery. They are already convinced that addiction is a disease and that stigma needs to be eliminated so more people reach out for help and more lives will be saved. But I know there is opportunity elsewhere to move the needle on eliminating stigma. To bring about transformative change, I believe it's critical to extend my advocacy to the 1 in 3 people who believe addiction is a choice. To those who have the opportunity to unlearn old truths. I'm calling this my Winning the Hearts and Minds initiative, or preaching outside the choir. I'm getting in front of groups who may disagree with many of the things that I'm sharing with you today. I'm talking to these groups about the brain science of addiction and also sharing the data that shows incarceration is ineffective in addressing addiction. The power in sharing personal stories can bridge the gap of disbelief and help others understand that a culture of support will bring sustained recovery to those on the path from addiction to recovery. This past week, I spoke to a Chamber of Commerce in North Dakota. I shared all of the reasons why combating the disease of addiction should matter to them, as well as why it's important to eliminate the stigma of addiction in the workplace. Of the 23 million people in the United States that have the disease of addiction, 60% of them are employed full-time. $82 billion a year are lost in workplace productivity due to employees' heavy drinking. And the Surgeon General projects that our nation spends $442 billion a year to combat the effects of addiction. These facts and figures are substantial, but what perhaps might have been even more persuasive to the chamber group is when I told them about my own experience. I told them I would not have been speaking to them that day if not for the supportive work environment and the amazing team leader I had when I reached out for help at work, when I was at my lowest point and decided I needed treatment. I challenged the Chamber of Commerce business leaders to eliminate the stigma at work, to provide resources and opportunities to educate on the disease of addiction so that those struggling feel supported where they spend most of their time. As some of you may already know, one of the best ways to encourage and keep recovery is to celebrate recovery. And one of the best ways to eliminate the stigma of addiction is to be a face and voice of recovery. Since we held our first Recovery Reinvented in 2017, we have sought to recognize the courage and the strengths of those who have found recovery. This past December, when I spoke at the North Dakota Government to Government Native American Conference, hosted by my husband, the governor, I asked anyone in recovery to stand and be recognized. When people stood, it was honestly one of the most powerful moments in my life. Native Americans, government employees, and others standing together to be the faces of recovery. Some people stood to be publicly recognized for the first time ever. I made the same request when I spoke at the Chamber of Commerce event, and let me tell you, you could have heard a pin drop when I asked people to stand. But several people stood and were recognized at a work event. So I would like to do the same today. Join me and be a face of recovery. I invite everyone in this room who is in recovery to stand for your courage, your hope, and to inspire others. Please stand now. Those in recovery, remain standing if you would. Whether you are in recovery or not, whether you are personally struggling, if you have lost someone, this disease touches almost all of our lives in some way. Standing together in solidarity is how we are going to truly bring an end to the stigma. I would now like to invite all of you in this room who are impacted by addiction to stand as well. Okay, you can all sit now. Thank you for your courage to be recognized this afternoon. This simple act of standing for your recovery may be the one thing that inspires someone else in this room to reach out for help today. And for all of you, keep talking about the disease of addiction and recovery. Find 3 people today to have a conversation with about addiction and recovery. You will all be eliminating stigma and saving lives in the process. I would like to invite all of you to join us in the great state of North Dakota to reinvent recovery. This year, we are excited to hold our 3rd Recovery Reinvented event on November 12th in our capital city, Bismarck, North Dakota. We are always looking for innovation, change makers, and those who are passionate about changing the narrative. Reach out and connect with our team and attend a day of inspiration that turns dialogue into action. This event will be live streamed over the internet, so go to recoveryreinvented.com to learn more. Now is the time to put aside stereotypes, to put aside intolerance. Now is the time to come together to help those suffering from the disease of addiction. Now is the time for every one of us to take action in our lives, in our work, and in our communities. There's no shame in addiction. And there is so much hope and possibility in recovery. I'm like more than 23 million other people across our great nation who have the disease of addiction. And I am a face and voice of recovery. Thank you.
Actually, I'm going to hold on to this one. Okay, thank you, Catherine, the First Lady for Recovery in America. Yay! At this time, I'm going to ask the chairs to be set up out here in the front. We're going to have a little Q&A. We've got about 15 minutes or so. I know there are some people who have questions because they've texted them to me and so on, but you're going to have to ask them yourself. I'm not going to do it for you. So let's get the chairs out here. We have 2 mics, one to the left and one to the right. We would prefer that you use the mic because people who are receiving the live stream of this won't hear it if you just shout it out from the audience. However, I can also repeat it if you'd prefer to ask it to me. So we'll get our speakers to come on out. And I would like, I guess the mics are live back there. At the back. Oh, here they are. They're being set up here now. So who's got a question? Come on, this is your time to get to 5 SUD Talk speakers. You got a question and a comment. So here's what I need you to do, actually, if you don't mind. Actually, come here. Well, you can't reach it. So go ahead and I'll repeat it. Well, you'd be surprised. Yay! Woo! And I see you've got some of your brethren here too, right? Yeah, they're all good-looking guys who are out there fighting those fires and helping. Your mentors. All right, way to go, guys.
We use your services and your facilities probably more than most. It's not something that we're proud of, but we're humans. And when we sign up in a profession to give our lives, never having the opportunity to meet you, to see your face, to know your name, to know anything about you. And we see the things that we see every day, and we deal with the issues that we deal with every day, such as addiction and substance abuse, because when there's a problem with that, normally it means someone's going to call 911, and normally one of us is going to show up. And not only do we have to deal with it, we suffer from it. More than most. I know for me in 2004, on Valentine's Day, I lost 5 children in a house fire. What do? Do you start your life the next day as if it never happened the day before? No. You look to cope with it. But my comment more for you guys is, I am a government employee. I am. There is a stigma with us. Tell them a fireman, when things in your life go bad, who do you call? You don't call a politician. You certainly don't. You call a fireman because most likely we're going to solve it quick. That's what you do. 911, we're probably going to show up and help you out. You hope. But in our profession, it's nice that we can talk about addiction and we can discuss addiction. But we can't. Understand that we can't. When they talk about communication and sharing, it's something that we can do amongst each other. But we can't do it out here. We can't do it in public. I can't go to a house where you've called me to help your mother, your grandmother, and say, hey, listen, I'm a recovering alcoholic. But let me tell you why, because they don't want to hear the why. They just want to say, holy shit, I don't want this person on a fire truck helping me. I give my life for you, but they don't want to hear your story or why. What do you recommend to something, a profession such as this? Such as a police officer, such as a soldier. We come back from Iraq, yeah, we have PTSD. Most of us did. Most of us do. We got 25 years in a career with PTSD, but it leads to these addictions. It's what we know is the normal now. It's how we cope.
So your question then is, how do you as public servants, particularly who work in the government sector, how do you become beacons of hope or advocates for the cause that brings us here today, correct?
Not
Okay.
My comment would be this. Communication is everything. Don't judge. That's the first thing. Don't judge. Be thankful. Be appreciative. Be humble. But maybe in your direction or in your speaking with other people. And then the basic facts of reality is, hey, it's a blanket thing. There's a problem in the entire nation, the entire world, without a doubt. But a lot of those people who are dealing with those problems, we deal with them ourselves. But yet we can't go to our employer and say, hey, we got a problem. Because when we do, we're gone, we're fired. So
let's get let me get some comment from our experts here about that. Thank you, sir, for sharing, and thank you for your good work. So, Andrew, why don't you tackle that one to start?
So, first of all, congratulations on being Mr. February in the Fireman's Magazine. That's a big, big honor. No, but seriously, you know, first responders, I mean, you know, if we really look at what's going on in this country, if we really look at the epidemic, first responders are the front line in preventing people from dying. And you guys, particularly down here, have been really proactive about making sure that first responders carry Narcan, connecting people with services, setting up warm handoff programs, all of these things. And so, you know, you're right. Like, you deserve help as well, because you're the ones out there saving our lives. You know, and it's not that way everywhere in the country. I mean, if you overdose in America, you better hope that you're in a state, and even a county or a city, where the first responders are going to resurrect you instead of sending you home in a body bag. So I 100% agree with you. I think we do need to have help for our helpers, as well as just expecting them to save us.
Please, Dr. Howard.
I'm really glad that you brought that up. I think, you know, you were talking so much about stigma and barriers to treatment, and certainly it's even more magnified in healthcare professionals, and especially first responders. I think some of my research has actually been in interventions for first responders and how to address secondary traumatic stress. So I think it's really, really important to speak with your peers, like you've been doing, and how important self-care is and positive coping, because the stress that you endure is horrific, and to say that it's not impacting you isn't transparent. So I'm glad you brought that point up. Very important.
Thank you, Dr. Howard. We have a question over here. And if you wouldn't mind, if you're comfortable identifying yourself and where you're from, that would be great, but you don't have to.
Yes, my name is this on? Yes. Rodman Steele. I've been involved in the state of Florida here. I'm from West Palm Beach, but I've worked for the Prescription Drug Monitoring Program Foundation and helped to create that, and in fact incorporate it a few years ago. So directed to Scott Strode primarily, but everybody. There are two big things happening through research and whatnot. We're finding that there are physiological changes with exercise, very important, prefrontal cortex, and how that's changing and helping and assisting people being able to shake addiction. And then, of course, the psychological and the psychiatric side of it that the First Lady mentioned and everything, which is very, very important in the change of stigma. Scott, you've got them both. You've got the camaraderie, you've got the physical changes going on with your exercise. Can you weigh one against the other, or are they both equally important, and how do you evaluate it?
I mean, I think that at first, when people come to the Phoenix, the hook that keeps them coming back, just to use terminology from the old days, what keeps them coming back is that dopamine response, the exercise, the pushing themselves and having their brain wake up again in a different way without a drink or a drug in the system. But I think what keeps them long term is the tribe that they're building around them while they're there. You know, when I show up and I'm having a bad day and I fist bump with my new friends in the gym and we do a hard workout, usually by the end I forget what I was so stressed about anyway. So the exercise is certainly a powerful piece of it. But we've also seen Phoenix be successful just in social events. And it's the same kind of tribe that you have in the firehouse. You know, it's like, it's your crew. They'll be there for you no matter what. And having that gives you courage to step into recovery in a different way. So I think it's both.
Thank you, Scott. Another question, comment? There we go, please, thank you. And if you're comfortable, identify yourself and where you're from.
I'm comfortable. So my name is Alan Barsky, and I'm from north of North Dakota, Regina, Saskatchewan, if anyone from North Dakota knows, but currently at Florida Atlantic University. More recently, I came from the lighthouse at Hillsborough Inlet. Just climbed to the top of it, and it was interesting on the ride over to the inlet, the captain said, you have to go up to the top because when you look down, you see all the people in the ocean surrounded by sharks, and they're kind of oblivious to it. So coming here to the Beacons of Hope, I was thrilled to hear how each of you are changing and expanding the narratives on substance use disorders. My question for the panel is, how do we make sure that this discussion extends to all sorts of different cultures and socioeconomic backgrounds, and making sure that we're attending to some of the stigma that apply there as well?
Susan, do you want to start with that one?
Okay, I think I understood you to ask how we can spread this, make it more contagious.
And particularly, you know, so it's not just a white audience or middle class audience, but making sure we're really extending it to all groups.
I just think what we can all do is talk about it incessantly, you know, until people fall asleep. And I think, as you were saying, Mr. February, it doesn't get talked about enough. And as we've all said, I mean, we're a pretty hopeful bunch up here, but we've all talked about not being able to talk about it. And that is still the way of the world outside of, I don't know that much about Florida, so that's still the way of the world in New York City, and I'm not going to tell my Harvard story, right? So people don't want to talk about it, and they don't want to, many times they don't want to know about it, and I think you just have to find a way to connect with them and talk about it. And I think every room full of people that goes out and talks about it makes a difference.
Catherine, you have talked about it on the reservation, among other places. Can you share a little bit about that?
Yeah. So in North Dakota, the average lifespan on our reservations is 58 years old. Because of the effects, the health effects from addiction and other health-related things like diabetes. And so we have, the governor has an initiative called Tribal Engagement. I also have an initiative to do what I can to partner with the tribes, because they are part of a system that's completely broken, a 100-year-old system that is not working for them anymore. And so, you know, when people, you know, say, well, you know, they have their own Indian health thing and whatever, but, you know, it's just, we need to come together. Every Native American in our state is a citizen of our state. They are, you know, we need to wrap our arms around them and help them and partner with them more. So we've got some great progress happening on, we have a youth council that created this strategic plan for development for their community. You know, it's everything from, you know, getting grocery stores started to programs, you know, and so engaging the youth. And we have another, a woman who started the first recovery community organization in our state on the reservation. We don't have any of those. And so though, you know, we're engaging Native Americans, we're partnering with them because they're very concerned. You know, there's just meth is a really big issue on the reservation. But the other situations, I've been a part of, you know, several different roundtable discussions. I challenged the director of the CDC. I was on their website trying to learn about what are they doing to combat stigma, the stigma of addiction. And they have a lot of great information about the stigma of HIV and nothing about the stigma of addiction. So I spoke at an event where he spoke, and I sort of publicly said, hey, how about this? Anyway, so, you know, I think it's, you know, this roundtable discussion I had was an opioid round. You know, there were a lot of different people there from a lot of different walks of life. And so it just really is continuing to say, you know, we just need to keep talking about it. But, you know, how do we specifically target different cultures? You know, I don't know. I just think we just have to, you know, talk about it everywhere.
Andrew?
Just real quick for extra credit from the Phyllis and Harvey Sandler School of Social Work. I'm just kidding, actually. Dr. Barsky's part of the faction with Nilise Luna, who doesn't believe in great inflation and does not give extra credit, having had both of them as professors. But anyway, no, this is a really good point that you're bringing up, though, because, you know, we know how to treat people. We don't have a problem getting doctors into treatment. We don't have a problem getting lawyers, judges, pilots, basically anyone with a trade association behind them. But when we talk about poor, double and triple marginalized, socioeconomically disadvantaged populations, those are the people that are really falling through the cracks because we don't have equitable access to care. We don't have treatment on demand. We do not have an equitable system that gets people better at the same rate. You look at how, doctors have no problem because they get 3 months of inpatient, probably over with William, and then they get 9 months after that of subacute cares, followed by 5 years of subacute care communal support programs. And they recover at unbelievably high rates as a direct result of that. But when we're talking about poor people, we're willing to spend $75,000 a year keeping them incarcerated, 20 years at $1.5 million of taxpayer funding. But if they ask for help, like, we don't have any money. We never have any money when people ask for help. Oh, but if we get you, we got services immediately. Click, click.
The question.
I want to say thank you for reading my mind. My name is Frank Mussolini. I've been in the substance abuse field in one way or another, starting with my personal journey in the early 70s, and been involved with treatment ever since. I'm currently working at a Baker Act receiving hospital, dealing with just the clientele that you're talking about. And I have to tell you that being in the field this long, I do feel like I'm part of a broken system. I feel like the system is broken from the federal level on down. Okay, and I'm going to just say that I see people in a Baker Act receiving a hospital receiving $1,000 Band-Aids for $100 problems. They need a place to go, so the police Baker Act them, and we treat them with $1,000 a day treatment. And our federal government is paying for it. Medicare patients get special treatment because they can stay longer. And then, unfortunately, the patients I see who have Medicaid or no insurance, I have 5 days to try and foster a desire for change, and I'm good, and I can't do it. I can do it with maybe 1 in 100, and I am good, and it breaks my heart. It breaks my heart to see that we can't get through to a segment of people because our federal government keeps them sick. They give them $600 to $700 a month, and that's just enough for one good load, and then living on the street and coming back next month. I see patients sometimes 10 times in a year. So my question is, what are we doing on a federal level to address the broken system? I'll sit down.
Catherine, you know about that, and Scott will go to you after.
Yeah, you're like literally doing it.
Well, I've been fortunate to be called to DC quite a few times to meet with the people that are, trying to make a difference at that level. The dollars being targeted to try to make the system better, the work being done, in so many different ways. I mean, I guess I would say that it's not perfect, but and there's still a lot of a long way to go, but at least there's more money being spent than there ever has been for a while on this topic, and especially related to opioids, which is a bigger issue, across the nation. But obviously, there needs to be equality. There needs to be parity. The parity thing, it's not happening like it needs to be. So I guess I'm grateful that there is discussion at the federal level, and there is work being done, and there is money being put towards it. But obviously, there's still more equality that needs to happen for sure.
Yeah,
Scott, and then we'll go to Dr. Howard. Scott, go ahead.
And that's honestly why I'm sort of calling for that idea of creative destruction, right? Like, let's come up with something better. And let's not wait for it to come down from the federal government. Let's do it in our communities. I mean, sitting right out here, we have temperance training, which is a program very similar to Phoenix. And they have free programs every week for anybody who's 48 hours clean and sober. They can show up at their gym and take part of this new tribe that'll help support them in recovery. And yeah, it's right here in town. They're right there. So raise your hand, guys. So make sure you talk to them after, or you come tomorrow morning at 9 a.m. to CrossFit Hype and you work out with us. Because it's free, and we don't have to wait for some federal grant to show up to make it happen.
Heather?
Well, I just want to say that Scott said I could be his partner tomorrow at 9 a.m., and I'm going to do it. I'm really excited. So I'm excited to work with you all. But, just addressing what Dr. Barsky stated, we're talking about socioeconomic status, right? And addressing housing and addressing unemployment and addressing all these things we don't know are associated with substance use. So it's, and reducing isolation, through encouraging these community and peer support. We can all create recovery-oriented communities.
Question.
Yeah, good afternoon. I want to thank you all for coming here. First of all, my name is Thomas DiBartolo. I'm a local addiction professional. I've been working in the field since 2006. And this question, for anybody in the panel wants to field, I think there's two pieces of this conversation I've been talking about regarding the industry itself. One is, for a lot of people that work in this field, case managers, therapists, all that, like these first responders, we're dealing with trying to help people get clean and save their lives. However, I think one of the problems is the kind of pay, the wages that people in the field are actually making. I heard people say, I read stuff in the newspaper recently about people leaving this field, going to work at Walmart and Costco. They can make more money that way. They're fighting with it. They're not getting paid what they're worth for what they're doing. That's number one. The other piece that is too, I think the other thing that's been talked about is how the recovery community kind of works together. I hear a lot of talk about that, but going to a lot of events in this county the last several years, including going to the meetings of the Palm Beach County Substance Awareness Coalition, I don't see a lot of treatment facilities, at least not that I hear of, having bed space for people. If you don't have good insurance, or if you don't have $20,000 in your pocket to walk into a place, they're going to go, unless they have scholarships, and that's few and far between, sorry, we can't help you. Where do you go? And every one of these meetings I go to looks around the room, and there is no place for you to go, at least not yet, or not any place decent. So I think those are two things that really need to be addressed as far as, obviously, the professionals getting paid what they're worth in some of these fields. Like I said myself, I bounced around several jobs, not that I even wanted to in some cases, simple the fact that I wasn't making a good enough living. I had to move to something to make more money. And what I guess the recovery community is doing in general to kind of offer bed space for people that they know aren't going to get paid just to help them out.
Sure. Go ahead. Who would like to tackle that one? Andrew?
Sure. I mean, what you're talking about is a fundamental problem with the funding mechanism, right? So we have a couple proposals that we're pushing right now in DC. One of them is on shifting to a values-based care, outcome-based reimbursement model, specifically to drop, because it's actually, even if you have decent insurance, a lot of times the insurance companies they're really squeezing the middle class out of access to care with, exorbitantly high deductibles and, and that actually feeds into your other question in terms of like paying people what they're worth and not expecting, healthcare workers to accept poverty wages for what, let's be honest, is not a 40-hour-a-week job. So, one of the proposals basically is that you shift and you have insurance companies pay 50% of the reimbursable rate at every single level of care across an entire continuum of care. And then if there's no acute care episodes, so no detox, no residential treatment, no emergency room, then the insurance payer pays an additional 100% for a total of 150%, which motivates success. I mean, you're financially paying for wellness as opposed to paying for sickness. The other one, which is actually significantly more important, and what we're really going to have to do in the grand scheme of things, is we're going to have to shift to legislatively structuring transferable tax credits. Because here's the problem, right? The way that you deal with a public health crisis is you raise taxes and then you have money to pay for services. But we're never going to do that because we hate taxes more than we hate poor people dying in this country, which is an entirely separate problem and a whole nother conversation. But what you can do is you can legislatively structure tax credits that are transferable to other industries. We have them in agriculture, we have them in the entertainment, and you go shoot a movie in Atlanta, you're getting like a $10 million tax credit, right? So what you need to do is you structure them so that anyone can just walk into treatment anywhere. And then if you have like a nonprofit treatment center, they just bundle those up. Then they go hit up like the Marriott, and you're like, hey man, here's $10 million in tax liability reduction. Federal tax credits are trading for 94 cents on the dollar with like $9.4 million in cash, and you literally are able to treat every single person in this county that needs services.
Catherine, go ahead, and then we'll come to you in a second. Go ahead, Catherine.
Can I say one thing? So I'm glad you brought up the pay for wellness, because in North Dakota we're doing this thing called Free Through Recovery, where we diverted $7 million to help people that were either at jeopardy of going to prison or, or were sentenced there. And so they're diverted away from prison. They're diverted back to their community, where we've got care coordinators who hire peer support specialists. And so we're meeting people where they are at home, which doesn't require sober living places and treatment centers. I mean, obviously, there's a need for both of those as well, and then those care coordinators are paid for wellness. And that's something that was part of the criminal justice system, but now we've got a bill of the legislature to open that up to the general public, because in general, we need to pay for wellness. Like, did they get a job? Do they have a place to live? Are they going to meetings? Are they working a recovery program? And that's a program that's not happening in any other state. And it has reduced recidivism, parole violations, and that sort of thing.
Susan, quick.
Yeah, I just want to say, you've heard today about an incredible program that's free, 2 of them, Alcoholics Anonymous and the Phoenix. So, if what a person wants is treatment, there are plenty of places they can get it in the most extreme and complete way for no money.
Question next. Right here.
Can I respond to that, please?
Let's go to the next person. And you know what? You can talk to, we're going to have our guest speakers going to be out in the lobby afterwards if anyone wants to follow up. Go ahead.
My name is Maria Faber, and I lost my son last year to an overdose. And my question is, and thank you all for being here.
I'm so sorry. Can you speak up just a tiny bit?
Yeah. I'm sorry, it's a little difficult. My name is Maria Faber, and I lost my son to an overdose, a 27-year-old last year. And all the issues you brought up are very, very important. One thing, however, that I think there is a big flaw is the model of treatment that there's out there, because this 30-day stint rehab that cost the families thousands and thousands, the tune of $28,000 or more a month, and that we don't have, and that we go and borrow, and we, you know the whole nightmare involved with addiction. And then they're out, and the recommendation is go to a halfway house, where they go, and I get it, the whole we and support, because they're all in the same boat, but they're all struggling with the same issues. And they don't have any support in these places at all. So they're pretty much saying, okay, 30 days where they're hardly detoxed. And they're sent out there, and they're supposed to get a job, find themselves a therapist, do all of this stuff when they cannot even get themselves in their head. They're not even together yet to do anything. So is there anybody thinking of this model of that this may be changed, and
Go
that,
ahead.
because it really is not working.
Scott?
Well, first of all, I just want to say I'm so sorry for your loss. And Phoenix, we hear about from hundreds of loved ones, every year who have somebody struggling or have lost somebody. And I agree. The system, doing more of what we're doing isn't going to fix this issue. Just simply adding more of something that isn't working that well isn't going to get us there. We need to think about how we're doing this in our country and do it differently. We really do, because I don't know an answer for you. The system itself needs to be done differently.
I'm not sure what's happening here or where you are with peer support specialists, but for us in North Dakota, 50% of our population is rural. So we're never going to have treatment centers and sober houses in all of our communities, but the peer support specialists with lived experience, we're all in on that concept because, just like you say, after 30 days, you don't have, you're not, but if you have someone with lived experience who's a resource who can help connect you to where you need to be in the community, in my opinion, that's a great answer to those people that are, because the gap between treatment and recovery is the biggest risk. So the peer support specialist model, to me, really addresses that gap.
Yeah,
Question over there.
Yes, actually, my name's Lynn, and I'm actually a graduate student here at FAU in the social work program. And first of all, I just wanted to say to the lady over there, I'm very sorry for your loss. And to the panel, thank you. I love the diversity, the different areas and the different viewpoints that we get. And addiction is very close to me. I am in recovery myself. I had a mother who overdosed of an opiate addiction and a father who's incarcerated. So addiction hits very close to home to me. And, I just want to say that, I don't believe that there's one quick fix. It's multiple systems, it's multiple people, it's multiple professions, it's a variety of academics, and they all work together. There is no one thing, but there is one thing that will save an addict, and that's another person. If you have some kind of support, or if you're that support person, because there isn't an addict on this planet that can do this alone. Thank you, you guys.
Thank you for your comment. Last question over here, and then we're going to be done.
John O'Brien, in recovery since 2000, MCAP student. Question for you guys. I love your emphasis on getting rid of the stigma of addiction and rewriting the narrative. My question for you is about the developmental model of recovery that does justice to the brain science. Could you briefly address that?
So the question is...
The developmental model of addiction. Doing justice to the brain science, explaining it.
Go ahead, Dr. Howard.
And maybe I know what it is, but I don't know that terminology. Go ahead.
Doctor.
Well, I think when you're thinking about developmental, it really starts in this attachment period. Scott talked about having healthy attachment. 0 to 3 is so essential, really, in the very young infancy stage of having all the correct brain connections. And that is it's becoming a new science and really understanding the brain disease. And I think that helps decrease the stigma, absolutely, but that we understand that it is a disease and very complex.
Today is one day in this next step towards helping people who are not here today, those who are not yet experiencing the beacons of hope and help and healing. So I hope each of you will carry from here today something and take it back into your communities, into your schools, into your churches, into wherever it is you think you can help somebody from what you've learned here today. Let's also remember that next year we want to double the size of the people who have attended this today. And so if you all have liked what you've heard today, please talk about the positive experience you had so that we can develop some buzz in the community, sober buzz in the community. so that we can turn them out big time next year. I also want to thank ShowPro for all that audiovisual technical stuff that happened. It was flawless. And finally, I want to thank all of our speakers and all of you for being part of the solution today. Good night.
We love you, Tony.
Can we thank the panel? And can we thank the panel?
Yeah, we thank the panel. Yeah, we did. Thank you.
Should we do it again next year?
Yes, do it again next year.
Let's close with a serenity prayer.
No, this is fantastic. You are annoyingly smart, grading papers while all of us were studying your speeches.
Call to action.